After a solid 2018, how are you going to keep up momentum in 2019 and manage costs?
Well, we have a very good pipeline, and we have no more drugs coming off of patent over the next couple of years. So I think the good growth rate will be there. Then I think it's all about being able to manage cost in such a way that we can continue to fund a big R&D effort, while at the same time making sure that we can execute well on the profitability that lies in the growth rate.
What does that mean for your China strategy? Because it is your second largest market globally, and sales growth has been very strong thanks to the government making more drugs reimbursable, wider healthcare, and also more R&D coming out of this very market.
All of those are good things, and obviously internally at AstraZeneca we have a very good pipeline developing, including R&D in this country. But on top of that, we see a country which has now a speed of approving drugs, making them available in the Chinese market, different from before. And we also see the focus on Healthy China 2030 with a lot of quality and emphasis on quality, plus the fact that access comes out to a much bigger part of the population. And of course, all of those are external factors that makes me optimistic about our business in China.
Tell me about some of the things that you're doing in digital healthcare, because as you were telling me, you think the payoff could be significant if China invests a lot in this area in terms of more patient-centric care, in terms of more preventative care. For example, at your innovation center in Wuxi, you can actually connect every point from the ambulance to the traffic lights, to the nurse, to the operating table. Tell me more about that.
We start out by being patient-centric, and then we look at how can we actually deal with the patient best. And the chest pain project is one of those where we can actually follow a patient all the way from the first feelings of chest pain through the ambulance, through the emergency room, and even into the operating table. And we can then connect all of that in such a seamless way that the patients, from the patient's point of view, we can get that patients into treatment much quicker and therefore with much better forecast. In an overall sense, you can say what we do in Wuxi, and I should say with the help of local government, is actually to look at how we can connect most everything. And if you think about the world in the future, we will have cloud computing, we'll have 5G networks, and we will have very cheap storage, inexpensive storage. And if you think about that combination, that means that we can store a lot of patient data. We can even derive medicines out of that patient data. We can provide telemedicine out into rural areas, connecting specialists into a center, and therefore get much better primary care experience out in the areas around the big cities.
I counted there are 9 global CEOs of pharmaceutical companies at the China Development Forum. Do you think it signifies a particular, increase in interest in the Chinese market as it tries to open up more and also create a level playing field for foreign investors?
In general, you can say we have reasonably good times for the pharmaceutical industry right now. That means that there is a wave of science that comes over all pharmaceutical companies. And of course, with the size of the Chinese market, but also with the support of wise, both local and national governments, plus the fact that there is a growing R&D base going here, that probably makes China a very interesting country to be in.